So I've been getting asked a lot of questions about this article that just came out, breaking news all over the place. It is literally on every single news outlet. Here it is again. Georgia woman sues IVF clinic after she says she gave birth to another family's child. So obviously super disturbing news and information. We expect when we're using fertility care, we are getting our own eggs, our own embryos, our own sperm. So let's talk about it. I'm Dr. Allison Rogers. I'm a double board certified reproductive endocrinologist. And not only do I do IVF every day to help my patients, but I've also have my family through IVF. So the story behind this case is that a single woman used a sperm donor, had a baby, and when the baby was born, she didn't feel like the baby looked like her, had testing, and found out that she was not the biological mother of the baby. The clinic then went and looked at and found out who were the biological parents. This person then decided to give up custody of her child to the biological parents, who were, sounds like, thrilled that they had a family, and she was unfortunately left empty-handed. This is a horrible story for so many reasons, but let's talk about why this should never happen. So we use something called chain of custody. When any biological specimen comes into our lab, whether it's sperm, embryos, eggs, it has several things on it, including the patient's name, date of birth, and every single step, we have multiple, sometimes more than 2 staff members double checking that the patient's name is the name on their wristband, is the name the patient verbally says, and it's the name that goes on their dish. So every one of the steps, right, from collecting eggs, collecting sperm, processing sperm, injecting sperm into the eggs, growing the embryos, and then transferring, this is done. We never have more than one person's biological material on a workspace or laboratory bench at one time, so that there is no way of a mix-up, picking up a wrong tube or something. The other thing is that before I do a insemination, this is where we put sperm in the uterus, which was not done in this case, but before I do an insemination where we put sperm in the uterus, I double check, the custody is double checked when the specimen is dropped off, including looking at the ID. And then before I transfer the sperm into the uterus, the patient looks at the name, we verify it with multiple staff members, and then the patient and physician and provider, like nurse, will look at the name on the actual catheter that has the sperm in it. So there's a lot of, checks and balances in place there. From an IVF perspective, before I will put an embryo into anybody, they have to verify that their name is the name on the dish. And if there's a partner, everyone has to verify that that is the name. And we verify that with the patient. We verify it with the dish. It is verified every step of the way. This is a horror story. I'm so sorry this happened to this patient, but I can tell you that this should not happen. And I'm so sorry to all of the people involved in this mix-up. It's a horrible thing. I also feel bad for the doctor and the clinic, because clearly that was not their intent to have an error like this. But these errors are huge and they are devastating, and we do everything in our power to make sure that we are not on the news for that kind of situation. If you have questions about chain of custody, making sure you're putting the right eggs, the right sperm, the right embryos, you need to have a conversation with your medical provider about safeguards that they have in place. And you should be reassured that your biological material is labeled with your name and getting back to you.